Friends, greetings to you. Today I want to talk about a very important topic, chest pain. This is one of the most common symptoms that brings people to the hospital, and at the same time one of the most alarming. Why? Because behind this pain there may be something completely harmless, or something life-threatening. And the first thing I must say, if you feel sudden, severe chest pain that lasts for more than a few minutes, especially if it is accompanied by shortness of breath, nausea, dizziness, or radiates to the arm, back, or jaw, call 911 immediately. Do not wait, do not try to endure it. In such cases, time can be decisive. Now let's figure out what exactly can cause chest pain. The first thing we think about is the heart. A heart attack, or myocardial infarction, occurs when one of the arteries supplying the heart muscle is blocked by a blood clot. A person feels severe pressure, squeezing, or burning in the center of the chest, and the pain may radiate to the left arm, shoulder, back, and sometimes even the abdomen. Cold sweats, nausea, and weakness often appear. There is also angina pectoris. This is when the vessels are narrowed but not completely blocked. Pain occurs during physical exertion or stress and disappears at rest. There are also rarer but extremely dangerous conditions, such as aortic dissection, when the body's largest artery begins to tear from the inside. This causes sudden, very severe, stabbing pain, often felt in the back between the shoulder blades. But the heart is not the only cause. The lungs can also be the source of pain. If a blood clot blocks a vessel in the lungs, pulmonary embolism occurs. This is accompanied by sudden shortness of breath and sharp pain that worsens with inhalation. Another situation is pneumonia or pleurisy. In this case, the pain is sharp, stabbing, and felt more strongly during coughing or deep breathing. There is also pneumothorax, when air enters the pleural cavity and the lung partially collapses. The person feels sudden sharp pain and shortness of breath. Chest pain often masks digestive problems. The most common example is gastroesophageal reflux disease. Acid from the stomach enters the esophagus and causes heartburn, a burning sensation behind the breastbone, which is very easy to confuse with heart pain. Similar sensations can also come from ulcers and gallstones, when the pain radiates to the upper abdomen and chest. Let's not forget the musculoskeletal system. If you lifted something heavy, exercised, or were under stress, the pain may be related to the chest muscles or the cartilage between the ribs. This type of pain usually worsens when pressing on a specific spot or during movement. So, the range of causes is very wide, from harmless to critically dangerous. That is why it is extremely important not to draw conclusions on your own, but to seek medical help in time. How do we distinguish dangerous pain from less serious pain? The first thing to pay attention to. In the hospital, several basic methods are used for diagnosis. An ECG is done to check the heart rhythm and signs of a heart attack. A blood test for troponins is taken, special proteins that appear when the heart muscle is damaged. A chest X-ray or CT scan is often performed to assess the condition of the lungs and large vessels. If digestive problems are suspected, endoscopy or other tests are prescribed. Why is all this important? Because sometimes symptoms overlap. A person may be sure they just have heartburn, but in fact it's a heart attack. Or vice versa, fearing for the heart, when it's just muscular pain. Only a doctor with the necessary tests can determine the exact cause. As for prevention, the best thing we can do is take care of our heart and blood vessels. Control blood pressure, cholesterol, and blood sugar levels, quit smoking, and move more. At least half an hour of physical activity a day significantly reduces the risk of serious problems. Stick to a healthy diet with vegetables, fruits, and whole grains. Don't forget about water and activity during long trips or flights to avoid thrombosis. And most importantly, never ignore new or unusual chest pain. Even if it seems not serious, it is better to get checked. In medicine, it is always better to be cautious than to be late. Take care of yourself, your health, and your heart.